14 foods are destroying your kidney health. Hi and welcome back. In this video, we'll look at 14 foods that are bad for your kidneys. Taking just a little time to care for your health can pay off big time. So make sure to watch the whole video because I'll share important tips with you. Our bodies are like complex machines, and every part needs to work well together. That includes our kidneys, which help remove toxins. What we eat can really affect our kidneys. Some foods are good, but others are not and can make the kidneys work too hard. Today, we're going to talk about 14 foods you might eat often that could be damaging your kidneys. This is especially helpful if you're trying to keep your kidneys healthy or if you've been told to eat a kidney-friendly diet. Keep watching to learn about these foods and see if you're eating something that might be causing harm to your kidneys. Let's get into it. 1. Bananas. Bananas are tasty, easy to carry, and good for you. They're a popular choice for many people's diets, but they might not be the best fruit for everyone, especially if you have kidney problems. This is because bananas have a lot of potassium. Eating just one medium-sized banana gives you about 422 milligrams of potassium, which is a lot for people with kidney issues who need to watch their potassium intake. Even though bananas are healthy, they can make you feel full and help with digestion. They're not for everyone. Some people may be allergic to bananas and can get symptoms like itching, swelling, and trouble breathing. Bananas also have magnesium, which can make you feel sleepy, and sugar, which could raise your blood sugar if you eat too many. In conclusion, bananas are a healthy food choice for many. But if you have kidney problems or need to control how much potassium you eat, you should eat less or avoid bananas. If you need to eat fruits with less potassium, there are other good options to try. 2. Alcohol. The liver and kidneys work closely together. When the liver is damaged from alcohol use, alcoholic liver disease, it impairs kidney function. A diseased liver cannot filter blood as effectively, which puts additional strain on the kidneys. Alcohol can have direct toxic effects on kidney cells. This toxicity can lead to changes in the kidney's ability to function. Over time, chronic alcohol consumption can result in kidney cells swelling, becoming damaged or scarred. Alcohol consumption can alter the normal balance of electrolytes in the body, including sodium and potassium. These electrolytes are crucial for the proper function of not only the muscles and nerves but also for the kidneys. Imbalances can lead to problems in kidney function and affect the regulation of fluid and acid-base balance. 3. Red meat. Eating a lot of red meat can give you protein, iron, and vitamin B12, but too much might be bad for your kidneys. When you eat too much protein, your kidneys work harder to get rid of waste like urea and uric acid. This can be really tough on people who already have kidney problems. Plus, red meat has a lot of saturated fat, which can increase bad cholesterol and lead to clogged arteries, raising the risk of high blood pressure and kidney disease. Eating too much red meat might also cause kidney stones, because it can change how calcium and citrate leave your body in pee. This can make it easier for painful stones to form. Besides kidney problems, too much red meat can also lead to other health issues like heart disease, some types of cancer, and diabetes. It's okay to eat red meat sometimes, but not too much, especially for people who need to watch out for their kidneys. Before we continue, if you have been enjoying the video so far, hit the like button, and don't forget to subscribe and hit the bell icon, so you don't miss more videos like this. 4. Spinach. Spinach is really good for you because it's full of nutrients. But if you have kidney problems, you need to be careful with it. Raw or a little cooked spinach has a lot of potassium and oxalates. Eating too much potassium can trouble people with kidney problems by causing heart issues. Oxalates can lead to kidney stones, which are painful and can damage the kidneys, especially if you already have kidney problems or are likely to get kidney stones. Spinach also has a lot of vitamin K1, which helps blood clot. This is important for people on blood thinners because too much vitamin K can make their medicine work less well. While vitamin K isn't a kidney problem, it's still something to think about for your overall health, especially if you have heart or kidney issues. So, it's best not to cut out spinach completely, but to eat it in moderation, especially if your doctor told you to limit potassium or oxalates for your kidneys. 5. Dark-colored sodas. Drinking a lot of dark-colored sodas might not be good for your kidneys. The problem is that they have a lot of phosphoric acid, which can make kidney stones more likely because it makes more calcium show up in your pee. These stones form when calcium mixes with other waste in your kidneys. Also, these sodas have a lot of sugar. Too much sugar can lead to weight gain and being overweight, which makes it harder for your kidneys to work well and raises your risk of kidney disease. Too much sugar can also cause heart problems, tooth decay, and can lead to type 2 diabetes by making your body worse at using insulin. There's even caffeine in these sodas, which can make you dehydrated, and not drinking enough water can also be bad for your kidneys. So, if you drink a dark-colored soda once in a while, it's not too bad. But if you drink them a lot, it could be harmful to your kidneys and your health overall. It's a good idea to think about how these drinks affect your health before you have one. 6. Beans and lentils. Beans and lentils are good for you because they have a lot of protein, fiber, and nutrients from plants. But if you have kidney problems, you should be careful eating them. They have a lot of potassium and phosphorus, which can be hard on weak kidneys. Poor kidney function means potassium isn't filtered out well, which can lead to a serious condition that affects heart rhythm. Also, if the kidneys can't get rid of phosphorus, it builds up in the blood and can mess with how the body uses calcium, leading to bone problems and itchy skin. It can even make the arteries harden and increase the risk of heart disease. Still, beans and lentils are very nutritious and can be part of a healthy diet. If your doctor says you should eat less of them because of your kidneys, you can lower their potassium and phosphorus by soaking, sprouting, or boiling them. Also, beans and lentils might make some people's stomachs upset, causing gas and bloating. This is because they have a certain kind of carbohydrate that's hard to digest. In short, beans and lentils are healthy, but people with kidney issues need to be cautious. If you prepare them the right way, you can still include these nutritious foods in your diet. 7. Pickles. Let's talk about pickles. Pickles are a common food that lots of people like to eat, especially in sandwiches. They taste sour and can be tempting to eat, but if you have problems with your kidneys, you need to be careful with them. Pickles have a lot of salt, and eating too many salty foods can be bad for your kidneys. When your kidneys can't remove all the extra salt, it can lead to higher blood pressure and more work for the kidneys. Eventually, this can damage the kidneys. Also, the acid found in vinegar, which is used to make pickles, might cause trouble. If you eat a lot of it, it can make your body very acidic. This makes it difficult for your kidneys to keep the right balance in your body, possibly causing acidosis and kidney stones. Having too much salt can also cause other problems, like fluid buildup in people with heart issues, swollen legs, and increased risk of heart disease and strokes. While having a pickle once in a while should be fine, eating them a lot can be bad for your kidneys and your health overall. It's a good idea to watch how many pickles you eat and to choose foods that are better for your kidneys. 8. Tomatoes. Tomatoes are usually good for you because they have lots of helpful things in them. But if you have problems with your kidneys, you should be a bit careful. Tomatoes have a lot of potassium. A medium one has about 292 milligrams. They'd also have oxalates, which can make kidney stones if you eat too many, especially if you're likely to get stones. Also, tomatoes have something called solanine, which some people might react to with swelling and joint pain, often if they have arthritis. Plus, tomatoes are acidic, which can cause heartburn or acid reflux in some people. Tomatoes have lots of vitamin C and antioxidants, but if you need to watch how much potassium or oxalates you eat for your kidneys, you might have to eat fewer tomatoes. It's always best to think about your own health and eat things in moderation. 9. Dairy products. Dairy products are good because they have a lot of important nutrients like calcium and vitamin D. However, people with kidney issues have to be careful with them. Dairy has a lot of phosphorus, which is normally good for bones, but too much can be a problem for someone with kidney disease. When kidneys don't work well, they can't get rid of extra phosphorus, leading to weak bones and itchy skin. It might even cause heart problems. Dairy also has a lot of protein, which can be hard on the kidneys, and saturated fat that can raise bad cholesterol and increase heart disease risk. While dairy can be part of a healthy diet, people with kidney problems should eat it in small amounts and talk to a doctor to plan their diet right. 10. Oranges. Oranges are well known for being full of vitamin C and are usually a good choice for health. But if you have kidney problems, you might need to think twice about eating them. Oranges and orange juice have a lot of potassium. A medium orange has around 237 milligrams of potassium, and a cup of orange juice can have up to 496 milligrams. People with kidney problems might need to eat less potassium, so they may have to cut down on oranges or not eat them at all. Oranges are also acidic. This can cause heartburn or acid reflux in some people, which can be uncomfortable. Also, oranges might help form kidney stones in people who are prone to them because they have oxalates, which can join with calcium in pee to make stones. Still, oranges are very healthy and can boost the immune system because of their high vitamin C. If a doctor hasn't told you to eat less potassium for kidney reasons, or if you don't have issues with antacid or oxalates, you probably don't need to stop eating oranges. Just eat them in moderation and think about your own health needs when adding oranges to your diet. Let's move on to the next topic. 11. Processed meat. Processed meats like ham, bacon, and hot dogs are easy to eat and taste good, but they may not be so good for your kidneys. These foods usually have a lot of salt, which can raise your blood pressure, harm your kidneys, and make them work too hard, damaging them over time. They also have a lot of protein, which can make your kidneys work too hard. Besides, they contain unhealthy fats that can increase your risk of heart disease. Eating too much processed meat can also increase your risk of getting cancer. It's better to eat less of these meats and choose lean unprocessed meats or plant proteins for a healthier diet. This can help keep your kidneys and overall health in good shape. 12. Canned food. Canned soups and ready meals are quick and easy options for when you're short on time, but they may not be great for your kidney health. This is because they often have lots of salt to make them taste better and last longer on the shelf. They also have chemicals added to keep them fresh, which could hurt your kidneys. These foods are also low in important nutrients and might be full of bad fats and sugar. This isn't great for your health and could lead to weight gain, heart problems, and type 2 diabetes. Some people might also get allergic reactions to the additives in these foods, like headaches or feeling bloated and tired. If you care about your kidneys, try to eat less of these canned foods and go for fresh, homemade meals instead. This lets you pick healthier ingredients. Eating a balanced diet with lots of different foods in the right amounts is essential for good health. It's important to know how food affects your body, especially your kidneys. Canned foods can be okay sometimes, but not too much. Always talk to your doctor or a nutrition expert if you have kidney issues to get advice that's right for you. 13. Avocado. Avocados are good for you because they have lots of nutrients. However, they can be a problem for people with kidney problems because they have a lot of potassium. Too much potassium is bad for people whose kidneys can't get rid of it from their body properly. This can cause serious heart problems. Avocados also have a lot of calories, and eating too many can make you gain weight, which is not good for your kidneys. Being overweight makes kidneys work too hard and can lead to kidney disease. Also, being overweight can lead to diabetes and high blood pressure, which are bad for the kidneys. If you have kidney problems, you should eat avocados carefully, following a diet that is low in potassium and calories to keep your kidneys healthy. 14. Dried fruits. Dried fruits are fruits from which the water has been taken out. People like to snack on them or put them in sweet dishes. Raisins, dates, apricots, figs, and prunes are some dried fruits you might know. Even though they look healthy, they're not good for everyone. People with kidney problems or diabetes should avoid them because they're high in sugar and stuff like potassium. For instance, a small half cup of dried apricots has a lot of potassium, over 30% of what someone with kidney issues should have in a day. Dried fruits also have sugars that the body turns into energy very quickly, and that's bad for people with diabetes. If you have kidney disease and want to eat fruit, some better options are apples, berries, grapes, lemons, limes, pineapple, and watermelon, as they don't have much potassium. Remember, what you eat can really make a difference to your health, so think about your choices and aim to live a healthy life. And if you found these tips helpful, like, share, and subscribe for more health advice. Every meal is a chance to improve your health, so make good choices. Stay healthy until our next tip.